Hey neuro nurses and rapid responders. When a patient spikes a fever and complains of a pounding headache with a stiff neck or confusion, you need to think fast. Today we're diving into meningitis and encephalitis, two life-threatening infections of the central nervous system that demand quick recognition and skilled nursing care. Both conditions affect the central nervous system, but they impact different structures. Meningitis is inflammation of the meninges, the protective membranes covering the brain and spinal cord. Encephalitis is inflammation of the brain tissue itself, often leading to more profound changes in cognition and behavior. Both can be caused by viruses like enteroviruses and herpes simplex virus, or bacteria such as Neisseria, meningitis, and Streptococcus pneumoniae. Fungi can also be a cause, especially in patients who are immunocompromised. And just to note, transmission often happens through airborne droplets, direct contact, or bloodstream infections. So let's talk about the key symptoms you need to recognize. For meningitis, the classic triad is fever, nuchal rigidity or stiff neck, and altered mental status or photophobia. Other signs might include headache, vomiting, and positive Kernig's or Brudzinski's signs. Now, encephalitis shares some similar symptoms, but you'll also see more profound behavioral changes, seizures, and hallucinations. Plus, there can be focal neurological deficits like speech impairment or motor weakness. When it comes to diagnosis, the key steps include performing a lumbar puncture to analyze cerebrospinal fluid. But if increased intracranial pressure is suspected, a CT scan should be done before the lumbar puncture. Also, remember to get a complete blood count, blood cultures, and PCR testing for viruses. For treatment, start empiric intravenous antibiotics right away. Don't wait for lumbar puncture results. If you suspect a viral cause, add antivirals like acyclovir. And don't forget dexamethasone for bacterial meningitis to help reduce brain inflammation. Critical nursing interventions really make all the difference. First, frequent neurological assessments are essential. Keep a close eye on the Glasgow Coma Scale, pupils, orientation, and watch for any seizure activity. Be alert for signs of increased intracranial pressure like headache, vomiting, or Cushing's triad. For seizure precautions, make sure to pad the side rails, have suction ready at the bedside, and document any episodes you see. Fluid and electrolyte balance is also super important. Monitor intake and output closely because there's a risk for SIAG and dehydration. Maintain normothermia using antipyretics and cooling measures as needed. For infection control and isolation, use droplet precautions for bacterial meningitis and educate the family about hand hygiene and proper use of personal protective equipment. And finally, don't underestimate emotional and supportive care. Reassure anxious families and do your best to promote a calm, low-stimulus environment. The bottom line here is, time saves brain. Whether it's meningitis tightening the meninges or encephalitis inflaming brain tissue, these infections move fast. But with skilled nursing care, early recognition, and continuous monitoring, lives and brains can absolutely be saved. So, have you worked with meningitis or encephalitis patients? Please share your best practices in the comments. And don't forget to like, subscribe, and follow for more neurocritical care breakdowns, because fast nursing saves function. And remember, assess early, act fast, protect the brain.